Hello friends, 51-year-old man with rheumatic valvular disease with a 10-day history of fever now had a severe headache and dilated left pupil. Lumbar puncture shows elevated opening pressure and copious neutrophils in the cerebrospinal fluid. His brain MRI is shown. So this is a ring enhancing lesion which is probably cerebral abscess. How can we explain the history and findings? Here the patient has rheumatic valvular disease. So the organism which has causing this rheumatic valvular disease has entered the blood, and it through hematogenous spread it has reached the brain, causing cerebral abscess. What additional complications may occur? Whenever there is cerebral abscess, it can cause compression of adjacent structures leading to hemiparesis or any developing, any focal neurological deficits can occur. Then it can also increase the intracranial pressure, thus causing cerebral herniation. So thank you for watching.